This recording will go over medications used to treat BPH. So first we need to know, what is BPH? BPH stands for benign prostatic hyperplasia. As a man ages, the glandular units in the prostate gland begin to undergo tissue hyperplasia, an abnormal increase in the number of cells, which results in prostatic hypertrophy or an enlargement of the prostate gland. The enlarged prostate gland contributes to overall lower urinary tract symptoms, either through direct bladder outlet obstruction or from resistance within the large gland itself. The man experiences storage and/or voiding disturbances, such as a sensation of bladder fullness, frequency, nocturia, hesitation when trying to begin urinating, dribbling of urine, and erectile dysfunction. Because these are the same symptoms that prostate cancer may cause, the patient should have a prostate-specific antigen or PSA blood test and may undergo a prostate biopsy to make sure no cancer is present. Traditionally, the primary goal of treatment has been to alleviate bothersome symptoms. More recently, treatment has also been focused on the alteration of disease progression and prevention of complications. The classification of medications used to treat BPH include 5-alpha reductase inhibitors, alpha adrenergic blocking agents, phosphodiesterase 5 inhibitors, and sometimes anticholinergics. Your prototype 5-alpha reductase inhibitor that you need to be familiar with is finasteride. And things to know about this classification include that women of childbearing age must not handle crushed or broken tablets due to possible absorption and potential risk to male fetuses. If the woman should come into contact with a crushed or broken tablet, they should immediately wash the contact area with soap and water. We also want to inform patients of an increase in high-grade prostate cancer in men treated with 5-alpha reductase inhibitors indicated for BPH treatment. We want to inform patients that the volume of ejaculate may be decreased and that impotence or decreased libido may also occur. We want to tell patients that they need to contact the physician if they have any changes in their breasts, including lumps, pain, or nipple discharge. Your prototype alpha adrenergic blocking agent is Tamsulosin. And some things to remember about safety when using Tamsulosin. The brand name of that one, by the way, is Flomax. So a lot of you are probably familiar with the brand name there. Tamsulosin is the generic name we need to be familiar with. So safety and administration for Tamsulosin, an alpha adrenergic blocking agent. Alpha adrenergic blocking agents are used to treat blood pressure, high blood pressure, right? We've learned about this already. To avoid a hypotensive episode, we want to avoid using it at bedtime and also reconcile all drugs taken before adding another antihypertensive drug. So we don't want a patient to already be on hypertensive medications and then start taking this for BPH without the doctor realizing they're on a different medication for hypertension and now their blood pressure is going to be too low. We also want to instruct patients to take these drugs with food, counsel about possible symptoms of postural hypotension, dizziness is what they have listed there, caution patients about driving, operating machinery, or performing hazardous tasks while using these drugs. Inform patients that orgasm with reduced or no semen does not pose a safety concern and is reversible when the drug is stopped. Also want to advise patients to notify their ophthalmologist about use before cataract surgery or any other eye procedures. Your prototype phosphodiesterase 5 inhibitor is tadalafil. Tadalafil, or not just tadalafil, other medications in this classification of phosphodiesterase 5 inhibitors are also used to treat erectile dysfunction. Nitroglycerin and other nitrate drugs used to treat heart disease can cause a significant decrease in blood pressure when taken with phosphodiesterase 5 inhibitors. Therefore, this class of drugs is contraindicated for use by any patient using organic nitrates in any form. We want to caution the patient taking a phosphodiesterase 5 inhibitor, such as tadalafil, not to take with nitrates, or they should also not take it with alpha blockers. And the final classification that is sometimes used to treat BPH is anticholinergics. It's important to know that anticholinergics are only used in men without large post-void residuals. So if you think about your anticholinergics and how it affects the urinary system, does it cause the patient to urinate more frequently or less frequently, an anticholinergic? So hopefully you're thinking less frequently, because you're going to see that fight or flight type body response. And so a patient who has large post-void residuals means they go to the bathroom, they urinate all they can urinate, and they still have a lot or a high volume of urine left in the bladder. So again, anticholinergics only used for men without large post-void residuals because we're worried about urine retention. With initiation of drug therapy, the patient should be followed every 1 to 3 months, depending on the class of drug chosen, to assess success and inquire about side effects. The patient with an enlarged prostate should avoid drugs that can cause urinary retention, such as anticholinergics, antihistamines, and decongestants. And we got a couple of practice questions here I'll let you look at. Go ahead and pause the video to read and pick out your answer, and then resume the video to hear if you are correct. So for this first practice question, the correct answer is C. Nitroglycerin and other nitrate medications used to treat heart disease can cause a significant decrease in blood pressure when taken with PDE5 inhibitors. Therefore, this class of drug is contraindicated for use by any patient using organic nitrates in any form. The correct answer for practice question number 2 is A. Tamsulosin is an alpha-adrenergic blocking agent which is also used to control blood pressure and can cause postural hypotension.